I'm Dr. Ellie, and I heal kids. And I'm here today. This is my very first podcast episode, and I'm here today to introduce you guys to me and just kind of let you know a little bit about me. I have a practice, Middle Path Integrative Pediatrics in Asheville, North Carolina, where I see kids for primary care, 0 to 21 years old. And I see kids for functional medicine, which we'll talk about later. What is functional medicine? Ages 2 to 21. And I also see adults for functional medicine. So if you need any of that, please reach out and text me, call me, or email me. My website is middlepathintegrativepediatrics.com. So I wanted to let you know a little bit about me and, why I established this practice. Why did I even open this up and do this whole big venture? Why didn't I just stay at my very nice employed position? Well, there's a lot of reasons for that. And one of those reasons is my values. And, what bigger reason could there be for that than your values, really? So, what are my values? What am I about? What am I here to do? Well, I'm here to serve children and I'm here to keep families healthy. So, in my previous employment, which was a great job and had a lovely patient panel and great colleagues and, all of the rest of that. But, really, I wasn't able to fully embrace these values that I have of serving children and keeping families healthy. And so with Middle Path, I've been able to, make a practice that does all of those things that I want to do. So I'm able to spend the time that I want with my patients. My patients get an hour and a half with me when they're a newborn. They get a 45-minute follow-up. They get access to me through the portal. They're not waiting 2 weeks to get an answer on, their kid has a fever, what should they do, et cetera, et cetera. So, you can see that you're able to get the information that you need when you need it. And in that way, I'm able to offer personalized care that goes beyond, just this is what I call the turn and burn practice. So it goes beyond you're just a number and, you've been waiting 2 hours and now you've seen a medical assistant and then you're sitting in the little room and you're filling out paperwork and then you finally see your doctor. And what happens? You see them for 5 minutes. You didn't get those questions that you wanted answered. And you're sort of rushed out the door feeling like, oh my gosh, I put in all this time to take off of work and come here and what happened, I just didn't get what I needed for myself or my kiddo. And so I wanted to change that and make sure that you guys come here and, you're not sitting in a waiting room. We have a greeting room that no one sits in, no one waits in. It's really just there for if there's other family members that don't want to be a part of the appointment and you're not filling in a bunch of paperwork that no one reads and you are, we get right down to business and we take the whole appointment time with me. So you get access to your doctor and you get those questions answered and you leave, feeling like it was a good experience, right? Like I came and I learned and my kids are going to be healthier or I'm going to be healthier if you're doing a functional consult, whatever that may be. And not only that, on top of the personalized care, we're doing root cause medicine here, right? So if there is something that you do have an issue with, for example, mental health, anxiety, depression, your kids are struggling with that. What is the root cause of that? We're going to dive deep and see if we can figure it out through functional medicine testing, which is a way to look at the body systems and the cells and the biochemistry in the body to kind of figure out what's going on. We're going to look at your environment. We're going to look at your diet, nutrition, exercise, mental health, relaxation techniques, the whole thing. So it's not just like you're going to come in and here's a pill and see you later. That's not how I do things here at Middle Path. What else? Why else did I start the practice? Well, I wanted to spend time with you guys. So some of y'all may be very familiar with like an insurance-based practice. And what happens at an insurance-based practice? Well, what happens is the doctors are reliant on the insurance company for reimbursement. So they're sitting there waiting and to be paid by an insurance company. So then they have to practice in a way that the insurance company likes, right? So you're not able to do holistic care and functional medicine. You're not able to take more than 15 minutes with patients. You have to do everything that's, according to an algorithm, right? So there's all these things in place that happen that cause doctors to have to be able to practice in this like system that, in my opinion, doesn't work for patients. It doesn't work for doctors. It doesn't work for staff. I'm not really sure who it works for, except for the insurance company. And that's why I don't take insurance. So we'll talk more about that in another podcast. But I want to be able to practice in a way that I get to spend time with you guys. I'm not rushing you in and out. And I can do holistic care. And what kind of holistic care do I do? So I'm a pediatrician. I have 17 years of experience. I was trained conventionally. Was trained at a tertiary medical center in Miami, Florida, where I saw all kinds of diseases, believe it or not, everything from kiddos that were really sick with kidney problems to tuberculosis to dengue fever. I mean, just some really sick kids, and got really good training there. And then I went on and practiced for a long time in conventional medicine, about 7 years. And after that point, I said, you know what? There's more that I need to learn here. And so one of the things that I wanted to learn was integrative medicine. And so I went back and did a fellowship. For those of y'all that don't know what a fellowship is, that is a training program. In my case, it was two years of a training program. Some people, it's a little bit longer, a little bit less, depending what kind of fellowship they do. That goes beyond your regular specialty. So my specialty was pediatrics. I had already trained in that. And then I went on and trained 2 more years in integrative medicine. And I was able to incorporate and infuse integrative medicine into my practice. And what is integrative medicine, first of all? So integrative medicine is an umbrella term for infusing all kinds of different modalities into regular medicine. So we're talking about, how do we bring in osteopathic medicine? I'm a trained osteopath. Like, let's bring that in. How do we bring in botanicals, herbals, mind body, nutrition, exercise, family dynamics? Like, there's all of these different parts that typically aren't brought into a visit. And why? One, training, because not all doctors are trained. And two, time. So that's another reason why it doesn't always happen. So I eliminated that problem, giving you guys plenty of time, and I'm bringing all of that into my work with you guys. And I was able to do that in an employed position for quite a while, and loved my job. But it really got to the point where I then wanted to learn functional medicine. And so what is functional medicine? Functional medicine is a way to determine how are things working in your specific body? How are they working with your specific genetics? So I'll just give like a really basic example. Let's say you're worried you're low in vitamin B, and you go to your doctor and you say, I think I'm worried, I might be low in vitamin D. I'm really tired all the time. I might be anemic. Maybe I'm not getting enough B12. I've been vegan for 10 years and I just never took a supplement, whatever. And they are like, okay, let's draw a level. And they draw the level, and the level is, quote unquote, normal in the blood. That level doesn't tell you one single thing about how that B12 is being processed in your body. Like, do you have a genetic mutation where you don't process it well? Is it not being absorbed into your cells well? Do your cells not use it well? Does it not interact? Does your B12 not interact well with your other body systems? Do you have inflammation in your body? So there's all these things where it doesn't give you a lot of information. And that's where functional medicine comes in. Functional medicine helps us look at how are things working in your particular body, and also how the different body systems are connected. So, the mind is not divorced from the body's not divorced from the brain, your liver's not divorced from your stomach. Like, we literally are physically connected, which is so funny that you even have to say that, but you just think about the body in general. It's like, it's physically connected. It's all in one. It's not like my liver's over here outside my body somewhere, and then like over here is my mind. Like, it's all connected. So how do all these things connect? And so I'm able to look at all of that as well, as needed, depending on the situation. For kids and adults, I can do functional consults as well. And at my other practice, they really were not in a position to be offering functional medicine. It just wasn't what they were doing. I was the only one that can interpret the tests. They didn't have a way to order the labs properly. It was really a challenge. And so I wanted to take that on, and I wanted to grow into this part of the skills that I have so that I can help you guys. And this was all, by the way, this was all in the face of the COVID pandemic. And I knew that I had these skills. I knew that I could help with depression, anxiety, ADHD, skin issues, gut issues, brain inflammation. You have it with functional medicine. And people were suffering, long COVID, all of these things. And I couldn't do that work at my current job. So that is another reason that I set up Middle Path, so that I could offer you guys those services and get you guys the help that you need. So again, what do I do? So I'm an osteopath. So what is osteopathic medicine? That's when you do body work. So I do a lot of infant body work. So, a lot of babies, when they're in the uterus, in the womb, they get kind of compacted, kind of squished in there, and they come out with some kind of body restrictions, whether they're not moving their neck as well as they should or their legs as well as they should. Maybe they just need helps with sleep, with relaxation, those kinds of things. I do all that kind of work. And then in older children, a lot of the work is around pain management, like kids that have headaches, or like in our world, a lot of problems with ergonomics, right? We're on the computer, we're like this all the time, and we're just, a lot of tension in our bodies, and our children are the same, right? So I do that work. And then integrative medicine, which we already discussed. So bringing in all the modalities that I possibly can: botanicals, herbals, mind body, supplements, nutrition, exercise, family dynamics, environment. I'm probably forgetting one in there, but that about sums it up. And functional medicine, which we just talked about, which is the way that everything is connected in the body and what's going on with the biochemistry in the cells. And then, not to be forgotten, conventional medicine, Western medicine, which in my opinion does a great job in acute situations. So what am I talking about here? Your kiddo broke their bone. Usually most people would agree that getting, a cast or something like that is really helpful in those situations. God forbid you're in a motor vehicle accident, you need blood, you need a surgery to get repaired. Western medicine's great for all of that. And I do a lot of that work as well. So I'm infusing four modalities in one to help you guys keep your family healthy. And not only that, I think, on that point, when I say keep your family healthy, what do I mean? So, a lot of people, of course, do come to me just for their kid. And, what I find is over time, they start saying, well, I've got fatigue and I've got weight gain and I'm, exhausted all the time and I have brain fog and, my hormones are a little off, all of this. Can you help me? And absolutely, like I can do functional medicine for adults as well. And so oftentimes what happens is, you'll come for your kiddo. And then actually what we end up doing is treating the whole family because, really it is hard to divorce, or take apart a child from a family unit, right? We're all connected. So we're all connected in community as well. And I think sometimes that is lost in regular medicine too. What else can I tell you about me? I'm here to care for you. I'm here to listen to you. I'm not here for any shaming. I'm not here for any judging of people. I'm not here to make anyone feel bad about past choices or anything that's been going on with them. I'm really here to help you guys optimize health the best way that I possibly can. And of course, there's work, right? There's always a little bit of work around that has to be done by patients, and I'm human too, so I do understand, there's a lot there with trying to figure out the best way to make things work, the best way to make changes, how do I get those systems and processes in place? And I am here for all of that as well. So I'd love to invite you. I'd love to invite you to Middle Path Integrative Pediatrics. If you'd like to set up a complimentary meet and greet, go on my website, middlepathintegrativepediatrics.com. There's a button right there on the first page. Just go ahead and sign up. Happy to talk to you one-on-one a little bit more about the practice, about me, what I do, or if you want a functional consult for yourself, also sign up for meet and greet, and I would love to have you guys there. And I am so happy to invite you and excited to invite you to Middle Path Integrative Pediatrics. And I'll see you guys in the next podcast. Okay, bye, and wishing you well.